I don't know if people could hear all parts of the comment. You hope not. No, I actually, it's very helpful to me. I heard it. And so basically, this was comments most welcomed about the process that the Institute of Medicine uses in terms of its completion of its reports. And it gives me an opportunity, if I may, just to comment very briefly on this, because the final product that one sees, which is the product by the committees that work on it, has also been given a very thorough review by a group of reviewers. And that process, in turn, was the subject of this discussion. You know, when I think about our reports and our staff, who also, as you all know, work very, very hard on pulling together all of the relevant comments and trying to help frame a final document. At that point, I always think our work is really just half over. The real work is now, okay, what do you do with this? How do you make it have an effect? And with whom? We're always looking for ways that we can enhance the caliber of the product as it gets to that stage, including the review. And I'll look forward to learning more in detail, if we can, and taking advantage of your experience so that we can continue to learn and improve the way we produce our final products. Thank you for your comment. Other questions or comments? Yes, one of our shy members. Scott, there should be a microphone. Yes. Good.
You've obviously done a superlative job with public health. And I commented earlier, 1988, 2003, the trilogy that you finished, the public health and primary care report. Where do we go now? I mean, the Institute of Medicine, obviously, as I said earlier, the 1988 report started a renaissance which have led us to this point in time with what are some really outstanding opportunities. Where do we go? Where does the Institute of Medicine go from here?
Well, if you mean the Institute of Medicine or the field of public health, both, okay. You know, Scott, your point about this series, it is remarkable. I'm getting to the age now where I can look back over 24 years of work from that really classic 1988 report you've alluded to. This was the IOM report that declared public health in disarray. It's no longer in disarray. It's arrayed. This is an example of a growing arrayfulness. However, we know that's not enough. We know that's not enough. There was a 2002 follow-on report called The Future of the Public's Health that also paved the way for the next phase of work, including the laying out of the 10 essential elements of public health practice. You've alluded then, as I know were discussed today, the trilogy, as I call it, that Robert Wood Johnson Foundation sponsored around public health in terms of the methods and data that were required, the legal foundations, and the underpinnings of design and funding that would be required. And of course, this more recent, even more recent report on the intersection of public health and primary care. As one looks ahead for the future of public health, I think you and the work here are already pointing to some of the most fundamental and necessary directions. Number one, health in all policy. Health in all policy. Public health as an aspiration is not synonymous with the work of what we currently think of as public health departments. And we need to be thinking about the objectives of the health of communities and people in ways that, yes, are spearheaded by our public health departments, but incorporate the private sector, incorporate other levels and departments of government, bring together organizations and community-based activities that are not traditionally thought of as part of the health enterprise, but have a truly critical role to play in the environments that enable us to be healthy, the programs that reinforce making it easier and cheaper to do the healthy thing, and enabling public health to fulfill its full mission. So that's number one. That is a very clear to me future. Number two, and this is very interesting. There was a poster. Where is Angie? She's here at dinner? She went to pick up something. Okay, while she's gone, I'm going to tell you. She has done some fantastic work on the financing of public health and thinking about the cost in connection with the quality and performance. What do we get for what we're investing? Another way of saying it is bringing business-like attitudes to the functions of public health. And that, we have to do that. We have to be better at that. So that's number two. And a third that I will mention, and it follows directly on from the primary care and medicine report, but that's just a part of it, primary care and public health, excuse me. The bigger issue is ending the Cold War between medicine and public health. And that is as much us as it is anybody else. I used to say that if only we could combine the values and the objectives and the principles of public health with the money and the stature and the professionalism of medicine, we'd have the problem solved. And I still sort of feel that way. But I think we've got to do it in a way that is open-minded, appreciative, mutually respectful, and engaging in truly shared solutions. And if we can do that, I think that we will really make progress. Public health in partnership with our delivery system, public health with a business-like attitude for investment that repays every dollar in health terms, and public health in all policy. Those would be my three goals for the future.